I'm Dr. Behram Pardiwala, Head of the Department of Medicine at Wockhardt Hospitals and the Director of Academics. Today I want to talk to you a little bit about hypertension with specific reference to the Indian scenario. Hypertension is known the world over as a silent killer, and it is one of the most dreaded diseases which exists in the world today, having the highest morbidity and mortality. It is estimated worldwide that about 25% of the adult population suffers from high blood pressure. In India, in the urban area, the estimate is between 35 to 40% of the adult population who has hypertension, and about 30% in the rural area. Very significantly, in the rural area, more women have hypertension than adults, than men. As far as this country is concerned, we go by the rule of halves or 50%. Only 50% of the patients of hypertension are aware that they have hypertension. Out of those, only 50% are taking medication, and out of those, only 50% are taking medication regularly without a break. And out of those who are taking regularly without a break, only 50% of them are under control, which means that in our country, our control rate for hypertension is just about 7.5%, which is abysmally low. And that is what contributes to the very high morbidity and mortality of this disease. Now, what do you do for hypertension? How do you control hypertension? There are a few basic tips which I could share with you. One is you need to exercise regularly, and that is at least 30 to 35 minutes every day, 5 times a week minimum. This can take in the form of either swimming or a walk or anything of that sort. The second most important thing is a diet. You should use what is known as a DASH diet, or a dietary approach to stop hypertension, which places emphasis on fresh fruits, fresh vegetables, lean meat, and less of dairy products, and more of nuts. This is an excellent way of preventing hypertension because it reduces the sodium in the diet and increases the potassium in the diet, and potassium is known to reduce blood pressure. The third tip that I could give you is to take medication, yoga. With these sort of things, you can relax your mind. And the more your mind relaxes, the less the hypertension. Lastly, of course, is medication. If you have to take medication, please remember that you need to take it regularly, without a break, without stopping, without defaulting. Because the moment you default on your blood pressure, your pressure will rise. And that is the most dangerous thing, that the rebound hypertension often leads to a lot of complications. Thank you.